I'm Dr. Lynn Lafferty, and I'm here today to have a chat with Dr. Judi Woolget, someone that'll be working with us in our classes, and we'll be getting a lot of wonderful information from. And we're going to have a chat about our immune system and about some of the things we're doing and seeing with our patients. So how are you today, Dr. Woolget? Thank you for joining us.
Thank you. How are you?
I'm doing great. So I'd like to introduce you with all your wonderful accolades. You're a board certified doctor in internal medicine and a fellow with the American College of Physicians. You have a master's in nutrition with a certification in functional nutrition and herbal therapy. You are a voluntary associate professor at the University of Miami Miller School of Medicine, where I met you because you worked there for 28 years and you did research, and I know you were voted Teacher of the Year, and you're the head of the clinic for executive medicine, and now you're in private practice, and you have a concierge practice in Miami, and she focuses very heavily in prevention of cardiac disease, memory issues, diabetes, and even cancers. And she loves to blend her training in traditional medicine with functional medicine and nutrition for support. And that's kind of how you and I got to know each other. So
yes, it is. Yes, it is. Well, I'll introduce you, Lynn. Lynn is a PhD pharmacist, a naturopathic doctor, and a diplomat of the American Clinical Board of Nutrition. She's also a master herbalist. She's an endowed professor in the Pharmacy College at Nova Southeastern University, and she worked in the Osteopathic College of Medicine previously for 7 years, where she helped set up an integrative medicine department. She also created 5 master's courses in functional nutrition and herbal therapies, and I'm very familiar with those because that was part of my master's training when I was attending Nova. And I will attest to the fact, Lynn, that you are an enthusiastic and fun teacher, and definitely get us to participate with these style of online classes. So there's no sitting back and falling asleep when you're at the wheel.
I might call on you, right?
That's right.
I might call on you. So one of the things I find very interesting, yesterday we actually had a faculty meeting online, and they had done a survey with the pharmacy students, and what they were finding is they actually love this style of teaching better, because sometimes they have to sit for 4 hours and just listen to lectures, and to have that 4 hours of lecture and be able to listen to it, take a break, and when they're ready, they felt like it actually gave them time to think about the information. So in our courses, you know, some of the things that you and I will be doing will be online like this, and people will be asking us questions, and we'll be talking to each other, and then other things we'll have recorded, and people can watch at home when we do the courses. Yep. So I wanted to ask you, how, since you were a traditionally trained doctor, how, you got involved in a functional approach, and, us working together for so long, and what you find with your patients and how they feel about what you're doing and that type of thing.
Well, I can tell you the moment that it clicked for me years ago, I remember sitting in a clinical setting, talking to a patient. I don't remember the patient's name, but I remember the experience where I was telling someone about their diabetes and handing them a prescription for medicine. And I felt like my eyes were glazed over and the patient's eyes were glazed over, and nothing was getting accomplished by the visit. And I guess at some point I just sort of felt like, with the tools I had in traditional medicine, I was literally handing them a piece of paper and the patient was expecting it to work. And as I moved into the realm more of nutrition, it was the patient got involved and took responsibility. And doesn't mean I was, removing medicines right away, but there was more of an involvement on the patient side. So that became more fun.
It is fun, isn't it, to watch the people heal.
Yeah.
And get involved in their own health, because I think, and I really think it a lot about the coronavirus and having to stay at home. I think part of people's anxiety is feeling a little bit of helplessness. What have you seen? I've seen that from some of my patients, but the first thing I tell them, turn off the television, or at least turn off the news.
That is definitely a rule in my house. I have all my kids home. They have online school, so they are busy in the day, but the TV is not on during the day. I turn it on only at night for an hour or so to make sure I'm caught up on whatever's important, medically out there, but it's much too overwhelming to have it on all day long, for sure.
Yeah, I think that it's overwhelming for sure. I've probably worked with about 6 COVID patients, and then beforehand I gave a lot of my patients some preventative things. What have you been seeing and doing?
I'm about the same. I don't have a tremendous number of COVID patients. I had 2 in the hospital. I've had some where super high suspicion based on their symptoms at home. And like you, I was, as we were starting to head into this, encouraging everyone to support their immune systems ahead of time. Not saying that what I was recommending would prevent COVID infection, but at least shore up the immune system so there was not another flu on top of it, or a sore throat or something else that might confuse us. So I was am a big believer in that.
Well, as a naturopathic doctor, we really believe, I was trained in allopathic medicine when I was in pharmacy school, but as a naturopath, we more believe it's not about the virus or the bacteria, it's about the host, meaning it's about your body and how are you taking care of it. One of the things I make sure that people have a good protein in their diet, because I think when we get stressed out, we're more likely to eat carbs. Carbs go into serotonin, which does make you feel a little better. It raises your blood sugar, which always makes you feel a little better. If they're going to have a carb, I always tell them to eat a baked potato or a sweet potato, something like that, where they'll get a lot of nutrition with it. How about you with diet? Have you?
I'm sort of on the same track as you. I'm definitely encouraging people to stay away from sugar. Sugar is a toxin and sort of a poison to the brain and the thought process. Staying away from processed carbohydrates like the crackers, cereals. Omega-3s are good for brain, for stability of mood, to avoid depression. So looking for tuna, salmon, things that contain those omega-3s, supplements if it needs to be in that form. Whole food is better, is what my Dr. Lafferty taught me in my classes. If we can get nutrients from whole food, that's the body assimilates it better. But staying towards those kinds of things.
So one of the things we're going to be doing soon is we're going to be doing a talk with the general public. I've had people on the webinars and talking about and getting their concerns. I like hearing from people and answering their questions. So I hope that people come with a lot of questions that come to us. I think that I can't say enough by supporting your immune system. I've been hit with a lot of flu because I'm in the pharmacy, my clinic's in the pharmacy. So we've seen, especially during the flu season, we probably would have 10 or 15 people a day, and they would come up to me and say, oh, what can I take naturally for the flu, to add on to what the regular doctor might have prescribed, or what type of cough drops or whatever. And I didn't get sick. A couple of times I felt like I might get the flu, and I just took my immune builder, which I take something called Contraplex and oregano oil, and I felt fine the next day. So I think that we really can't drive home enough how important it is to build your immune system up.
Absolutely. And, the other ways to help protect the immune system are through our activities, making sure we get enough sleep, quiet time for meditation, exercise to release endorphins, because those will go into the cell receptors and physically, emotionally make us feel better. So multiple ways to accomplish that.
Absolutely. And, stress, the adrenal gland under stress it eats up all your vitamin C, which is needed for the immune system. And it's very interesting because the patients I've had when I was little, my doctor was so old, he had Sigmund Freud as a professor at University of Vienna. And we would have a lot of viruses where I was as a kid. I don't remember having strep throat ever. He would always give us an adrenal shot. They used to be available. I don't think they're allowed anymore. And he'd give us licorice tablets, which is also fascinating because that not only supports the adrenals, but it also in studies, now these aren't clinical studies, these were microscopic studies, but showed that it did block the replication of the COVID viruses as well. So that's the licorice, though, you have to be careful not to take it if you have high blood pressure.
Okay. Well, I know there have been stories on virtually everything on COVID, and it's hard to separate fact from fiction, but I'm also aware, tagging on to what you said related to vitamin C,
Right.
There is a study going on now where they're using high dose vitamin C intravenously and checking to see what the results are with that. Now, that may factor into the adrenal gland being exhausted from the illness.
Right. And I know you like zinc, so you want to talk about how that works?
Well, when a virus enters the human cell, it wants to copy itself, and zinc will step in and stop the transcriptase, or the copying of that RNA, which is trying to churn out a lot of proteins. So zinc is known to stop transcriptase. So it would make sense that we would want to have adequate stores in our system so that if possible, it could be working in that fashion as a virus comes in contact with us.
And I don't think a lot of people understand that the symptoms you get, it is because a virus is in your body and doing certain things to certain receptors, but it's more of the immune system working that gives you those runny eyes and the fever and those types of things, the cytokines and things like that that are released in the body.
Right.
Yeah. We'll be talking about all this with our general audience next week, and I'm really hoping they'll join us, and I'm hoping they'll have some of their questions. And in the meantime, I hope that they'll take a deep breath and do all the things you recommended. It's really good to go out in the morning for a walk because that'll help you sleep better. You get the sun in your eyes, which helps facilitate serotonin into melatonin at night for you to sleep, and drink a lot of water and stay hydrated. One of the good things I've heard a lot of people, including myself, losing weight. So that's been a good thing through all of this. Now, we also are going to be having a symposium for physicians and pharmacists and medical personnel on the immune system. And we're going to be talking about how the immune system works and looking at labs that you see and what that means, for instance, with the white blood cells, the leukocytes, and that type of thing. And then the second, which is your topic, you're going to be talking about antibiotic and antiviral resistance, which is a huge problem. The World Health Organization named that one of the biggest problems. And we're going to be talking about regular therapies, how the chloroquine, I couldn't believe when I had a friend who's a physician, he's the head of the residency program, he's an attending at our county hospital here, and he said, we just had this miracle, we used chloroquine and Z-Pak. I said, and that's before I heard anything about it, before they announced it, and I go, chloroquine, that drug's like almost 100 years old. And it does come from the bark of a tree originally, so I think that's important to know. And so we're going to be talking about that and the herbal therapies with the physicians so they can see the research. Because like I said, there was a study that was done, the only study that I could find in the library, and the only reason I looked for it was my great-grandmother from Italy died when she was about 30 years old from the 1920 Spanish flu. And yet my other grandmother, who had an organic farm, who was only 40 miles away, she actually said no one even got sick during that time, and that they took elderberries. So I looked up Sambucus, and lo and behold, there was a group in a nursing home in Louisiana that had gotten COVID SARS, and no one died. Very quickly resolved itself with the elderberries. So I took that with how they extracted that and made that for my patients. So we'll be looking at the natural things that can help support the immune system and the medicines we're giving.
Right, very good.
Anything, would you like to say anything about antibiotic resistance?
It's a big issue. It's a really big issue. And you're kind of feeling this frustration related to COVID, where it can't be that the medical system doesn't have an answer, but we're getting to that point with antibiotics and bacterial infection. There are not a lot of new medicines coming out of the pharmaceutical companies. And if we don't rein this in and stop the overuse and unnecessary use, we could find ourselves in a bit of trouble.
Yeah.
With organisms that are working their way around and and building resistance.
Well, I just want to say I always love working with you, and I look forward to it. And I know the audience will look forward to hearing from you too. So you don't have anything else for today. I look forward to everyone joining us next week and also next month for our symposiums that we'll be putting on.
Sounds great. We'll see you then.
Okay, have a great day. Thank you.
Bye-bye.